Hi, I am Dr. Vineet Kumar, a cardiac electrophysiologist at the Inova Heart and Vascular Institute. In the next few minutes, I will talk about what causes atrial fibrillation, some of the common symptoms patients experience when in atrial fibrillation, and management approaches to this problem. Atrial fibrillation is the most common heart rhythm disorder. It affects more than 33 million people worldwide. AFib is usually caused by abnormal electrical impulses that start in one of the four pulmonary veins that deliver blood back to the heart from the lungs. These abnormal impulses travel into the top chambers of the heart and create a chaotic, irregular, and fast rhythm called atrial fibrillation. Pulmonary veins are tube-like structures which bring oxygenated blood from the lungs back to the top left chamber of your heart. Heart muscle cells can extend inside these pulmonary veins, and in most patients with atrial fibrillation, these cells are the sources of abnormal electrical potentials. There are three types of atrial fibrillation, which differ by how long the episodes of AFib last and how long a patient has been in AFib. These are occasional or paroxysmal atrial fibrillation, defined as episodes that are short and then return to normal rhythm spontaneously. Persistent atrial fibrillation, defined as an episode that lasts 7 days or more, or that requires a procedure such as a cardioversion to convert back to normal rhythm. And lastly, long-standing persistent atrial fibrillation. Episodes that last greater than 1 year and require a procedure such as cardioversion to convert back to normal rhythm. Left untreated, atrial fibrillation typically progresses from paroxysmal to persistent to long-standing persistent. Approximately 1 in 5 patients with atrial fibrillation will progress from paroxysmal to persistent atrial fibrillation within 1 year of diagnosis. Medications and ablation procedures can slow or prevent the progression of AFib. Atrial fibrillation may cause a wide range of symptoms. 70 to 85% of patients with atrial fibrillation experience symptoms, but 15 to 30% don't feel any symptoms at all. Patients may experience a rapid, irregular fluttering heartbeat in their chest, also known as palpitations. Some experience fatigue, shortness of breath, decrease in exercise capacity, chest pain, anxiety, or dizziness. Sometimes the first symptom is a stroke. This is especially common in patients who have no other symptoms. Once a patient is diagnosed with atrial fibrillation, physicians usually start by assessing their risk of stroke and starting a blood thinner if needed. This is because atrial fibrillation is associated with 5 times the risk of stroke compared to normal rhythm. We will hear more about stroke prevention in our next talk. Once the stroke risk is addressed, we focus on long-term management of atrial fibrillation. This involves a discussion between the patient and the physician about rhythm and rate control strategies and the best medical or surgical methods to achieve them. In rhythm control strategy, our aim is to restore the heart back to normal rhythm and keep it in normal rhythm long term. This can be achieved by medications or catheter-based procedures, and you will hear about both in detail in another segment of this video series. Rhythm control is the preferred strategy in symptomatic patients. The latest data shows some benefit of maintaining normal rhythm even in patients who are totally asymptomatic. However, depending on your health condition, age, severity of your symptoms, and other factors, care providers may choose to keep you in atrial fibrillation and just optimize your heart rate and control your risk of stroke. This strategy is called rate control. This was a brief overview of what causes atrial fibrillation, some of the common risk factors and symptoms of atrial fibrillation. We also briefly discussed rate and rhythm control strategies for atrial fibrillation. Thank you very much for your kind attention.